The Hospital Patient Protection chapter is an amendment to the Healthcare Facilities Act. It is a bill being passed through the Pennsylvania House of Representatives. The prime sponsor pictured here is Representative Gene DiGirolamo, but both Republicans and Democrats support this bill. There's 37 signed on currently. This bill proposes many changes. However, the three main goals are to raise the standards for nursing staff practices, increase the ratio of nursing staff to patients in various medical facilities across Pennsylvania, and to protect nursing staff from being reprimanded for reporting on unsafe patient conditions. And then all of these goals put together combine to make the overall goal of creating an overall safer environment for patients admitted to medical facilities within Pennsylvania. The Hospital Patient Protection chapter was introduced to the Pennsylvania House of Representatives on March 18, 2019. It was then referred to the House Health Committee, where it's still currently pending. The overall Healthcare Facilities Act was passed in July 1979, and it was also amended in 1996, 1999, and 2011. There are many actors playing a part in the passing of this bill. The formal actors involved are the members of the Pennsylvania House of Representatives, the board of directors for various medical facilities within the state of Pennsylvania, and the Pennsylvania State Nurses Association. The informal actors are the patients that reside or are admitted to medical facilities in Pennsylvania and their families, the nursing and therapy staff that work at these medical facilities, local taxpayers and insurance companies because of the funding that comes along with this bill, and healthcare educators and students. Other actors that could be potentially involved in the future are the American Occupational Therapy Association, the American Physical Therapy Association, and the American Speech Language Hearing Association. In order to get other actors involved, there will need to be more education on the importance of this bill. The Hospital Patient Protection Bill can be analyzed using the model of incrementalism. The advantages of this model is that the policymakers are able to analyze previous successes and failures and make adjustments accordingly. Also, the policy is broken down into many steps, so they can focus on solving each problem at each step, and then that will solve the overall problem. But there's disadvantages that come along with this as well. So because it's politics, there's many opinions and varying viewpoints involved. So breaking things down into smaller steps can be helpful, but it can also cause more solutions to be made, which can be hard to decide upon. And past failures are likely to play a part in the reluctance to sign the bill. For example, if in the past funding has been a common failure, then it may cause reluctancy for future politicians to sign on to a bill like this. There are two primary factors affecting the development of this bill. The first one being the overall economy. So if new nursing jobs were introduced in medical facilities across Pennsylvania, taxes would likely increase as well. It may also require insurance companies to change their policies and procedures when it comes to paying for hospital stays. This large shift in the economy would allow for the improved hospital stays and medical facilities and medical care overall, but it would be a problem for many families throughout Pennsylvania that are already struggling financially. And if taxpayers and insurance companies are not able to fund this extra payment that's required to support these extra jobs, the facilities themselves would be required to come up with the funding somehow, and that can be very stressful because some facilities are really struggling as it is to come up with funding for other parts. And so increasing the ratio of nursing staff to patients right now may not be effective, but if the funding was solved, representatives will be more likely to sign on to this bill. The second factor affecting development is the overall profession of nursing. So many people come out of high school and take jobs as certified nursing assistants. These are great entry-level jobs, but individuals in this field have a high susceptibility to burnout. One way to combat this would be to implement programs for people in these careers that would serve to increase their education and allow them to become licensed practical nurses and or registered nurses. Making this change would allow for the profession to grow in a way that is desperately needed. And another, if that's not able to happen because of funding again, another solution would be to call on professionals that are not from this country or not from this area, specifically in Pennsylvania, that could come in and work. So, say they weren't from this country, they would be able to come in, increase the available nursing staff in this area, and make the money that they want, as well as the facilities would be able to fill the jobs that are now required. And so it would be a win-win solution for both sides of the party. And then having this problem solved would also increase representative approval. Although this bill may not seem to pertain to occupational therapy directly, the low nursing staff to patient ratios across Pennsylvania in all medical facilities, but especially skilled nursing facilities, affects the implementation of therapy every day. So currently in skilled nursing facilities, only 2 nursing staff are required for 40 patients, and 2 nursing staff are required to get a patient on a bed using a mechanical lift. So if a patient has to use a mechanical lift to get out of bed, that means that 39 other patients are not being attended to and are not being able to get out of bed or to be able to perform their care routine. So if the nursing staff to patient ratio is low, patients are not getting out of bed on time for therapy. This means that either A, therapy sessions are being missed and not completed at an ideal time for the occupational therapist and for the patient, and or B, therapists perform the care routines in the morning or in the afternoon for the patients. Although this is within the occupational therapy scope, it may not be the occupational therapist's plan that day to do that particular treatment with that patient, and it may not pertain to the goals that the patient is working towards, so it would not be helpful for them to do this. So if we were able to increase the nursing staff to patient ratios, it would be able to increase the ability for the occupational therapist to focus on their jobs instead of having to compensate and help with other parts of jobs that are necessary in the skilled nursing facilities.